welcome to the Rare Info series. I am Dr. Aparna U Simha, consultant at ORDI. ORDI is Organization for Rare Diseases India. It's an umbrella organization for all the rare disease patients in India. Today's topic is Stevens-Johnson syndrome, a painful journey from burn to blindness. Stevens-Johnson syndrome is a rare, serious disorder of the skin and mucous membranes. It's usually a reaction to medication and rarely to an infectious source, which starts with a flu-like reaction followed by a painful rash that spreads throughout the body and blisters. It's a medical emergency that requires hospitalization. It can take weeks to months to recover. Stevens-Johnson syndrome can cause serious eye problems, including inflammation, pain, and vision loss. It can affect the conjunctiva and cornea, leading to ulcers, scarring, and even blindness. Early and aggressive treatment, including amniotic membrane transplantation and specialized contact lenses, is crucial to manage ocular complications. Stevens-Johnson syndrome is a serious condition that requires prompt medical attention. Ocular involvement is common, it's quite common, and can lead to significant visual problems. Early and aggressive treatment is crucial to minimize long-term complications. Regular follow-up with an ophthalmologist is essential for those affected by Stevens-Johnson syndrome. We are very happy to have Dr. Seema Krishna M with us to throw light on this ever important topic. Welcome to you, ma'am. Welcome, Dr. Seema Krishna. Dr. Seema Krishna is a cataract, cornea, refractive, ocular surface consultant at Nandadeep SERI Eye Hospital, Pune. She's the founder of Stevens-Johnson Syndrome Eye Disease Patient Support Group. She did her MS Ophthalmology from BYL Nair Hospital, Mumbai, and FMRF Cornea from Shankar Nethralaya, Chennai. She has worked for 5 years at BMC Eye Hospital, Kamatipura, Crystal Eye Care, Mazgaon, Team Eye Center Clinic at Bhayandar, Agrawal Eye Hospital, Chembur in the past. She joined Dr. Patwardhan's Nandadeep Hospital in 2020, where she did 2 years of work in Sangli, and since 3 years, she's been working in Pune at Nandadeep Hospital. She's been awarded the Best BOA paper in 2021, and she's also the award winner of the Best MOS paper in 2021. She's been awarded with YKC Pandit Award, which is given to young ophthalmologist innovators, in 2 consecutive years, 2021 and 2022. She has numerous contributions to the field of ophthalmology. She is the first surgeon in India to use cryopreserved cornea for therapeutic penetrating keratoplasty successfully. This has been published in Indian Journal of Ophthalmology. She has contributed to Decimet's striping without endothelial keratoplasty, that is DWEC, for FUX endothelial keratoplasty, and this also has been published in Indian Journal of Ophthalmology. Also, corneal neurotization using sural nerve is to her credit, and she has multiple publications to her credit. Her areas of special interest are dry eyes, scleral lens, Stevens-Johnson syndrome, and ocular surface diseases. We are very glad to have you. Thank you, ma'am. I hand over the stage to you. Yes. Kindly throw light on Stevens-Johnson syndrome and eye involvement, burn to blindness.
Yes. Thank you very much, ma'am. And thank you, ORDI, for this opportunity. So, as ma'am has mentioned in short about Steven-Johnson syndrome, so let me say that this is not only the one syndrome which we are talking about, it is Steven-Johnson syndrome and toxic epidermal necrolysis. So, they are basically the one consequences of one of the disease process only. So I bow down to my gurus in Nair Hospital, Mumbai, and Shankar Netralaya, Chennai, and I start my talk with this. So, Steven Johnson syndrome or toxic epidermal necrolysis, it is an rare disease. 1 to 6 persons per million per year they are affected, and in toxic epidermal necrolysis, for to say it easily, 10.4 to 1.2 persons per million per year. So it is more rarer than even than the Steven Johnson syndrome. But what is this? This rare disease list of India where they have mentioned all the diseases. So I searched in the S. So if you see, there is no mention of Steven Johnson syndrome or toxic epidermal necrolysis in any of the national registry. So I don't think anybody has tried for this. But Steven Johnson patient or TEN patient, their journey is something like burnt yet resurrected to fly high like a phoenix. Yes, they are burnt during their disease process through all the processes, like financially, physically, emotionally, socially, but they will still fly like a phoenix. So this is how the Steven Johnson TEN. So this is one of our SJS group patient who has shared his photos. So this is like whole body is burned. I am not keeping it for long time. Even the lips are burned. So this is something like condition. So this is the patient which I first saw in my clinic with the history of normal conjunctivitis. And then she was it was a time of a COVID and she was wearing a mask. There was nothing on the skin. So this is like some other ways of presenting Steven Johnson syndrome. So that's why there are a lot of history behind this. So I will slowly focus light on this. So just a lip involvement and some red eyes. So luckily I was well known of the disease. I sent this patient to the skin doctor and his her treatment was taken care. So it doesn't like always present in the same way. So who is responsible for this deadly disease? So there are obviously the drugs, which are the one of the most common cause, but there can be some viral infection like mycoplasma pneumoniae, herpes simplex, even your simple vaccines. So this is basically some kind of a immune reaction to which patient reacts. So there are so many drugs. If you have many of or many of the families, they say that don't give sulfa. So sulfa is one of the most common drug to cause this severe mucocutaneous reactions. There are many others to list. These are like most commonly found, but need not be necessarily that every patient will have reaction with these drugs. So there are some genetic factors which are responsible that only few patients get predisposed to develop an SJS. You can say it as a destiny also. So what happens in the SJS? It is like once it is triggered, then there is acid in the life. Yes, the mucous ulceration, as you have seen in these pictures. So they are not only in the oral cavity, they are in the eyes, nose, ears, even involving their genitourinary tract. So from the part where patient urinates or defecates, in that part also in the rectum, in the anus, there are so many ulcers. So patient cannot even drink sip of a water, cannot sit properly. There are ulcers on the hand, on the foot, cannot walk. So everywhere there are ulcers and ulcers and ulcers. So patient cannot drink, patient cannot urinate, patient cannot pass stool properly. It's like acid all over inside his body. So what are the challenges? So basically, why I mention about the first disease, because there is a problem of late diagnosis. This is like you have to know about the disease, and this is a very lethal disease, like almost 30% death rate. If you do the late diagnosis, there are so many complications, and there is improper referrals, because this disease does not involve only the medicine person, but it has to be done in the ICU. There has to be burn specialist, there has to be skin specialist there, and there has to be a proper guided protocol. But believe me, till now there are no proper guided protocol for this disease in India. In UK there are there, but in many countries over the all over the world, there are no guided protocol for this disease. So half of the doctor don't knows about the disease. So that's why the late diagnosis happen, the referral is late, and patient relatives are confused, they have never heard of the disease, so whom they shall ask. And the ophthalmologist role has never given enough importance, even by the medicine people, dermatologist people. So these are the some treatment option available. So such patient with so much of reaction, they has to be admitted in the ICU burn unit, and these patients can develop reaction even in the village. So they don't have all these things in the village. So normal simple hospital, they are also doing the treatment, and patient may not receive a proper nursing care, hygiene, or body temperature maintenance. They have to be kept in the proper box, electrolyte fluid balance has to be maintained, and first they should know that which drug has caused this, and they have to discontinue the drug. So there are many other diseases like viral mucocutaneous diseases in which there is no role of drug. So many of the times the doctor is continuing with the drug, and he is thinking that okay, this is an infection, I will give more antibiotic, and the things are getting worse and worse. So the double edged sword treatment is the steroids, because this is an immune reaction. So it has to be given in first 48 hours of presentation. Hardly any patient receiving, even now today also. Like recently, I had a call from one of the nearest hospital in Pune, and there the physician was waiting for the diagnosis to happen for 6 or 7 days. And luckily, we came into the contact, and I told him, please start her on steroids. And then on 6th or 7th day, the steroid was started. And this steroid, why they are double-edged sword? Because this patient's skin is exposed. There are very much risk of infection in this patient, and most common cause of death is the sepsis. That infection spread all over the body into the blood, and patient dies. That's why the physician is also scared to give the steroid. There are other forms of treatment, like mainly the immunosuppression has to be done properly. So there are many others they have invented, they have tried, some things has helped, something has caused catastrophe, but everything is like the proper hygiene and the immunosuppression, that is must. So is this the end of a story? If patient gets treated of SJS well and everything happens nicely? No. So this happened with the eyes. So this is the same patient who had only conjunctivitis, and third day you can see there are some rashes on the lid margin. The skin is getting peeled off. Her oral thing, her skin is like this, completely normal. Who will think of SJS in this? And this is how her eyes are looking like. So there are certain kinds of ocular treatment which we have suggested. The traditional one were there, and now recently the all ophthalmologists are moving to the proper newer treatment. So till now we were all trying with the lubricating drops, frequent saline wash, rodding of the conjunctiva, some steroids, some antibiotic drops, like whatever we had, we were trying it. But now recent years, we have a proper treatment for this disease. This is amniotic membrane. So yes, this is a placenta which provide blood, or which gives blood to the new life to the infant. And we remove the amniotic membrane from this placenta, and we implant it in the eyes. So it is properly washed away. All the hygienic precautions are taken. They are properly stored in the eye bank with all the sterile precautions, not like we this use. What is the challenges for the ophthalmologist? So doing this process in the ICU is painful for patient also and doctor also. Patient is already having burn all over we cannot give them anesthesia, and we need to convince everybody from the intensivist, dermatologist that let us do this process. Dermatologist, intensivist worried that I don't know whether patient will survive. Why you are doing all these things to the patient? So this is painful for patient, and relative again ask why. Patient is dying, patient is having skin reaction. What are you doing with the eyes? Eyes are red, you can give some drops. This is a difficult procedure indeed. I will show it. And it has to be done repeatedly. The once it is done, it does not finish. So many patients require 3-4 times the same procedure to be done. And again, the cost, ICU it is done, operational challenges, we have to arrange everything in a aseptic way, and then it has to be delivered to the patient. And this is how the patient is there in the ICU. So it is very difficult for an ophthalmologist to manage such kind of a patient. So how it is done, it is shown shortly in this video. Especially thanks Dr. Gunjan Verma from the Gujarat. She has done. So we have to go to the multiple hospital in their ICU and carry our all the instrument, bear all the questions from the relatives, doctors, and do this procedure. So anesthesia is applied on the lids, in the eyes with the form of ointment, and then it is given, then it is done to the patient. So if we miss this acute stage, then what happens? Nobody knows what is going to come. But it causes the chronic, irreversible, debilitated disease, which will be like never ending story for the patient and the doctor. Patient will not be able to cry because there are no tears left in eyes. So this ulceration and everything, it eats up all the cells which are forming the tears. And then in the end, absolutely there is a test we called as Sharma test, which can calculate how much number of tears are there, and it shows 0. And it is for rest of their life. Now, everybody who was rejecting ophthalmologist, they are now searching for the ophthalmologist. And by this time, the patient is already bankrupt because this acute stage and its treatment, it almost lasts from 15 days to 1 month. And the ICU and everything, a lot of cost is involved in all this thing. So this is the chronic stages, how the patient eye looks, like how their lid look, how they are looking. If it is not properly treated, their cornea can turn white. It can even perforate also. There can happen a hole in the cornea also. So as an ophthalmologist, we have to water these eyes. So we have so many drops, we have some bandage contact lenses, AMT as I have shown, it may be needed in even the chronic stages. So there is something called as a punctal cautery, which we say that a severe treatment. So this is why I am showing this video, because this I want to send this message that now the lay person should also know if SJS, okay, dry eyes, have you done the punctal cautery? Because this is one of the first treatment. We cannot create the tears. There are still no drops in the world which can create the tears or which can formulate the tear. So we only give lubricating drops to the patient. So this is a procedure which will at least keep the drops for longer time. It won't drain the drops in the nose or in the tears, in the pharynx. So this is how that will help them. So this is like first and foremost treatment which has to be done for this patient. So at least those who are attending this webinar will know that okay, SJS hai, punctal cautery kiya ki nahi. At least these things they can ask to the patient and even to the doctor. One minute. So there are other treatment called mucous membrane grafting. So this is how the patient is looking. Like if you are seeing the paper effect, their cornea is completely rubbed off because of some changes in their lid, and there are many scratches on their cornea. Their vision is something blur like this. And in them, we use the mucous membrane. So we have gone, as an ophthalmologist, we have gone to the gynec people. We have collected placenta from there, collected AMT from there. Now we will go to the mouth also. We will collect some mucosa from the lower lip and we will implant in the eyes. So whatever possible from our side, we are using everything and we are trying to save the patient's eyes. Then the comes old is gold. Even after doing all this surgery, the story does not end here. There is a Dr. Perry Rosenthal in 2007 who has discovered something called as scleral lens. So these are a type of a contact lens which patient can wear in his eyes. So if you look how big is this lens, why this lens? Because we don't have anything to create the tears, we give this lens. So this is lens is filled with the saline and then patient apply over his eyes. So this lens at least gives some lubrication, but as you say, this is a very big lens. It has so many advantages which it gives protection to the surface and liquid reservoir also, but this is not easy to insert. There are special plungers, patient requires special training even for the removal. So it is not simple contact lens. And if patient wears this, at least patient is able to open his eyes, patient is able to see. There is a lot of light sensitivity in this patient. So this is the patient, the same patient which I have shown initially, like she was diagnosed by me. So after doing all the AMT and everything, I have given her these lenses. So at least she is able to read, she is able to do her job and able to open her eyes. Otherwise, their eyes are always closed because of the dryness. So the tears play very much important role for the eyes. But the story ends here? No, for this patient, even the story does not end here because these lenses also have the problem. There are mucous secretion in these patients which are there and they can blur their vision in between. They have to remove their lenses and put these lenses again and again so that they can see it clearly. There is fitting problem. Many times the lenses are not fitting because their lids are not good. They are not fitting properly. We have to try so many sessions. Almost a week patient has to spend. There can come like only that saline does not go, but some air if it is go, it is going to cause some blurring of vision. There is a blinking problem in this patient because lenses are large, so lid has to go all over these lenses and blink. So sometimes this patient eyes look like a staring eyes. You won't see them as a normal eyes. The cost of lenses, they are very costly lenses, though some places they are available with some lesser cost. Many of the greater institutes in India like Shankar Netralaya, LV Prasad Hyderabad, they are giving it at very lesser cost, even free for some patient. But the problem of breakage is also there. Patient arrange so much of money and they have a low vision. So while inserting, if it falls, then it will break. And then again, all the story will come back. The waiting period for again ordering the lens coming here, because these lenses material is everything is done in Boston. Though LV Prasad Hyderabad has started manufacturing it, but there is still little bit waiting period for this. And the handicap, because now they cannot live without these lenses. They have to carry all this solution, all this plunger with them. One box has to be with them. Anytime there can be any problem, and the all the look and the social thing, everything they have to face. So it is like we have given them some solution, but they are now handicapped with that solution. They cannot live the free life. So is this enough for this patient? Some patient, yes, they may do well this, but they have to use the lubricating drop. They have to be dependent on the scleral lenses. But many of the patient story doesn't end here. So if you see the picture one and then the second picture on the upside on the right, so if the patient is not treated properly, their lids are closed completely. Then if you see the below right image, this is something called as keratoprosthesis, something called as the plastic cornea, which is fitted in the eye so that patient at least sees something. There are many other different types of keratoprosthesis. So this is like their eye looks. So it is not a normal eye, but at least some vision can be restored. There are some keratoplasties, there are some limbal stem cell graft done, but usually keratoplasty limbal stem cell graft does not survive well in this patient. And this is all what they have to bear. So thus, is this life changing for this patient? Yes, because they were not able to see anything. If their eye is completely closed, at least they are able to see something with this. But again, there are complications with this keratoprosthesis. There can be leakage through this keratoprosthesis. There can be retina can get detached, and there can be a sudden loss of vision. Though patient is following well, doctor is doing everything possible, but if suddenly retina detached, then everything is like gone into the vein. Though the surgery of retinal detachment is done by the very much special retina surgeons or the uh, uh, but still some get successful, some may not get successful. The infection chances are all there. We are in the tropical countries, patients are from lower socioeconomic, they, and even with the all aseptic precautions, still the risk of infection is very high. And sometimes with everything is going fine, the keratoprosthesis get extruded out of the eyes. So it is something like, if it is go very well, patient life changes, but it can go into the blindness anytime. So nobody knows about it, and there are many more complications about this. So what happens after this keratoprosthesis? The psychological trauma, you see that the cosmetic appearance is not that good, and there are some patients after whom, after keratoprosthesis, they have become like more psychologically depressed because they now see that how bad they are looking. So there was a cosmetic trauma. Plus these are not straightforward procedures. Some keratoprosthesis requires years of time, so there is so much of waiting, financial trauma to the patient, sudden loss of vision, even the no guarantee of vision cannot be given, and there is no permanent solution for this disease. So this is like never ending management for this patient. There are some eyelashes coming, even for the normal and very well managed patient, the eyelashes will prick into the eyes and they will cause problems. And the dryness, which is there till they die, the pain because of the dryness, light sensitivity, eyelashes, so many causes for the pain, and the repeated doctor's visits. So like all the SJS patients, they become very much connected to us. Like anytime they can call us about, because of this repeated doctor's visit. But for them it is painful to call us, because if there is any serious problem they will call us. And again, the social dilemma. Many of the patients are young, and in when they call me, and like only one question the parents has, or these kids has, like when we will marry, nobody is ready to marry to us, like how you can do something better that I look better. So there are so many social aspects to this disease, and this is how the one bottle is handed over to them for their rest of the life. So the bottle till their last breath is this lubricating drops. And these lubricating drops are not something like a magic or something. They have their own things. Monthly expenditure for this. There was a guy from Kerala who has even shown in the news that he has even the bags of, like big bags or cans of the where he has stored all his lubricating drops over the many years since like childhood. He developed the SJS, and now what he will do with these bottles and unavailability of, there are few drops which are patient are completely dependent on, and now they are unavailable in the India because the company doesn't seem some market in Indian continent, so they have stopped delivering it, and it is very difficult for patient to get it available from. And again, the handicap of carrying the bottle, put it in front of the social scenarios, and everybody will ask, even a pathfinder will also ask, what happened to your eyes, why are you putting, they will also tell that don't rub your eyes, and all the advices are given. Social blemish is there. And there was this Kerala patient. So lubricating drops, there are some newer medications like mucosta eye drops. So this is available only and only in Japan and India. They have to order online. Lot of cost is involved, and some patients has managed to order it, but again in between they stopped. I don't know why they stopped the delivery to the India. And there are other ebepimide drops. A few were done in the India, but there was no market, so company withdraw this all the drops. There are some cyclosporin drops, but there are no hard and fast one drop or one medication or any medication which will recover all these patients. And plus, with all the SJS, patient may have associated conditions like Crohn's disease, SLE, or Sjogren's syndrome, because this is something like an immunological impact. So there are many patients who are now troubling or dealing with two diseases at a time. So what I can do for this patient is like I'm started this SJS support group. So let me mention that I developed SJS in 2007 when I was doing my MBBS during my internship. I was fully prepared to become a neurosurgeon, but because of this, my whole dream is clashed in a one day, and I was in there in the ICU. The all the story till now, whatever I have told you, I have gone through all this thing: the waiting period, the scleral lenses, the MMG, the punctal cautery, the lubricating drop. Even if you see in my hand while delivering this lecture, also I need to put some drop in between. So all the social blemishes, all this marriage issues, everything I have gone through, so I decided to start some support group, because when my time was there I could not ask anybody. So at least they can ask me, they share their problem with me. There are some patients who talk their personal problem with me also, and they know that there are some people in the world who are struggling like us. So as a SJS support group, I am trying to connect this patient to the right doctor, because I myself have suffered for 2 years because of improper guidance or improper doctor consultation. So I did not got any advice from any doctor to go for to the special institute or something. So at least those patients who are there in my group, I tell them that which are the special doctors. So there are not, no, all ophthalmologists do not treat this disease. All cornea specialists do not treat this disease. All dry eye specialists do not treat this disease. There are only few people in the India and all over world which are interested in the SJS or ocular surface disease, which have dedicated their life. So I have collected their numbers with me, and I circulate their number among the patients so that they can get the right treatment at the right time. Also, when the patient talk like any other support group, they talk to each other, they get some moral support, some psychological support. Even I conducted one webinar where the psychiatrist was invited, so that at least they can discuss, and I have shared some psychiatrist number to them also, that it is very difficult to deal with your mind when you are going to something which is irreversible, never ending story. So I know that how the mind plays and how it is difficult to control yourself in such situation. I am trying to give them some medical support or some drops, because there are some patients which cannot afford a day-to-day spending of lubricating drops, their finances. So at least from my side, I am giving them some drop samples, or some drops are being sent to their addresses. The financial support, we are working on this, are it is still a support group, not a proper organization. So we are still working on this. And also we want to discuss about the any other chronic sequelae. So like, other than the eyes, there is something like a gynecological involvement, vaginal fibrosis. So this happen in the female. So this is very rare, but there are still patients and they cannot speak about it also. Like in for eyes, at least they can speak, but for this they do not, they cannot speak. So this is like platform for them, that they open up, and also they can they share their success and failure stories. So many of our patient has rejoined their work after they have joined our group, because they saw that many of the patients are still working, they are still earning for their families, instead of even with all these problems. So there is a lot to do for this patient. This is are some uh, opinion shared by these patients. Same, some received the treatment, some did not receive treatment. They were in different countries. In some countries, like many of the countries, there are no proper guidelines. So they have shared their stories there. So like, I have talked so much about AMT, but there are many patients who have not received AMT because ophthalmologist was never been called or was never given some major importance, and many ophthalmologists are still not doing this. So what future I am thinking for this patient, that at least this disease should get entry into the rare disease registry, national registry, so that they can get some policies for this, they can receive some funds for this, because many of the patients do not have a money to even go to the doctor, because that expenditure of spending some money even on the buses or the train tickets, they are not enough, they are very much unaffording. And even providing them lubricating drops, those who which are not available, and whatever available we can provide them. And these, about this lubricating drop, if patient is used to one type of a drop, it is very difficult for him to shift to the, so it is not like we can give any lubricating drop, we have to give them a particular brand only. So this is how difficult it becomes for some patient if some brand is become unavailable. And financial support also, we are trying, I have the doctors registry, and trying to include more and more doctors. And even in our webinars or our ophthalmic conferences, we are trying to talk more about this, so that more and more young doctors become more oriented, and they are very much enthusiastic to work on SGS and TN also. Unless we get a newer brain or newer ideas, then we can come up with at least some final solution. Because my all the patient is just patient, even I ask that, is there some final solution that we can become normal, like some like we can get rid of these drops. And again, in India there is no disease registry, there is no documentation is done. So if it is done properly, then at least the SJS and TN patient can have some justice. Newer medicines, the researches and everything, there are many institutes in India which are doing many researches, but about the medicine there are still nothing much to be done, have been done. So I thank you everybody, thank you ORDI for this opportunity, and I hope that I have done justice to this topic. This was my effort to open up all about the SJS and its related eye diseases, the TN, and the patient struggle, and what we can able to do. And I'm really thankful to Mr. Prasanna Shirol. I got introduced to him in one of the webinar. So after that, his support is very much excellent. So on his footpath only, like we are trying to walk and do some justice to this SJS and TN patients. Thank you very much.
Thank you so much. What a journey you have had. And this was a much needed knowledge for all of us. And it's very heartening to listen to your part of the story and the way you have handled it. Thank you. ORDI is grateful to you, ma'am. Thank you so much. It was a wonderful presentation. Do we have any time for any questions? Hello, ma'am.
Yes, I'm there.
Hmm.
Yes.
How long can the scleral lens be kept? Like, how frequently the scleral lens has to be changed, ma'am?
It depends from patient to patient.
Okay.
So few patients like 4 to 6 hours, they need to change.
Hmm.
And few patient can keep even for 12 or 14 hours. But usually 4 to 6 hours is the time that they
Then
need
it
to
can be
change.
cleaned and kept. It can
Yes,
be
yes,
reinserted.
yes, yes. Yes, yes, it can be reinserted.
Oh.
It can be cleaned, the saline can be removed and the new saline. So that's why they have to carry all the bag, the saline, the plungers and everything, and the clean cloth and some sanitizer, so they can remove some at some places.
Hmm.
And once they bought these lenses, there are few patients like they have used these lenses even for 10 years, one
Oh.
lens.
Okay.
So,
What will
and
be
there
the
are patients,
approximate cost of the scleral lenses?
one lens or per eye, it costs something around 60,000. There are lenses which cost 50,000. There are lenses which cost 66,000.
No.
So it is like doing one big surgery. They have to spend so much of money.
Is there a role for salivary gland transplantation? Is it done in India?
Yes, yes. Yes, it is done in India, but it is not a permanent solution because
Hmm.
it is like the secretion is mucus and the salivary gland don't stay there for long
Hmm.
because surface is dry,
Hmm.
and some if there are some patient in whom salivary gland transplantation is done, but it stay for 5 6 years. Few patient it may stay for 10 years also, but usual the success rate is not there much.
No. Hmm. Who is prone for Stevens-Johnson syndrome? Because so many people take sulfa drugs or
Yes.
anti-epileptics.
So
We
that is
don't know,
you
like,
don't. So there are some HLA associations,
hmm,
but it is very difficult to means do it for a normal people
hmm,
because unless it happens to you, you won't know that okay, I was prone to SJS. If luckily in the first dose you come to know about something, then that is fine. But it requires the genetic testing obviously to know that whether you are prone for SJS or not.
okay. So HLA subtypes A0206 and DQB10601, all these carry increased risk for ocular complications. So
Yes.
when a patient with Stevens-Johnson syndrome is there, do we have to alert the other family members?
No, no, no. Because it is very hardly seen that in the same family the other patient occur. Means it is not nothing like familiar.
Hmm,
Even for the patients like who they have a kids. In that also they that means we tell them that do not worry about your kids. The
hmm,
same thing was told to me that do
hmm,
not worry about your kids. Not necessarily that your kids will have. There are very, very few reports that are telling that in SJS in one or two family member, but otherwise it is does not run in the family. So it is something like a sporadic. It is particularly for one patient, and that HLA also some mutation has to happen.
hmm. What is the role of stem cell transplantation, man?
So stem cell transplantation are done only in few patients, but again there are different types of stem cell like limbal stem cell we do in these patients. But again, if their eye is little bit moist,
Okay.
because this stem cell can survive, like if the soil is good, the plant can grow.
Hmm.
So
Right.
stem cells require a proper environment, and the wet eye is very much necessary. So most of the time stem cell does fail in these patients.
Any future research which is being done in any part of the world, man?
They are doing few researches, but nothing like on the medicine or something. On the surgical basis only there are few researches are done in. I think there is one question also. Does any particular gender consider to be more prone to this condition or both are at? So there is nothing like a particular gender prone to this. It can happen even in the male, female. So no prone for gender. Even for the age, it is not prone. Even in the children, it can happen. In the young age also can happen. In the old age also can happen. But usually the complications are more like in the old age or in the children. Even in the young there are there, but it is depends so much on how much was the disease severity itself and how it was managed properly. There is no yet study done on the prevalence incidences because this is being a very rare disease. There are some global studies done, but not any Indian study.
We are very happy to collaborate with you, ma'am. Thank you so much for the wonderful lecture. And
Can it be contagious? There is one more question. It is not it is not contagious. So this is like patient's own immunity reacting to the drug. So it won't spread to anybody else. It is absolutely not contagious. Yes, ma'am, you were saying something.
I was thanking you for throwing light on this topic, ever important topic to us. ORDI is grateful and ORDI is happy to collaborate with you. And you practice at Pune, right?
Yes, I practice at Pune. And luckily, like you said, God is grateful. The way you are seeing my eyes is like near normal or absolutely normal. But the SJS patient's eyes does not look like this. So I literally say that God is grateful that with so much of our surgeries and so much of problem, even with the severe dry eyes, like my tears are also zero, but I'm able to do all the advanced surgeries, mucous membrane grafting, punctal cautery, even in my patient also. It's like God is grateful. He's chosen maybe
So
for
to
this
do
reason.
ophthalmologic surgeries, you need so much of precision and so much of concentration, and it
Concentration.
may be very difficult for you to do it with dry eyes. And I
Yes.
really
So
appreciate.
my assistant are also used to put drops in between.
Okay.
My sister, they will be like, I tell them that, yes, cysteine drop. So they know that in whom to put, whether in the doctor or in the patient's eyes.
It's very heartening to hear your part of the story. And
Yes, but I'm lucky that I'm able to work for this patient and able to treat them.
thank you. Thank you so much. Really
Thank
appreciate it. Thank you so much. It was a wonderful lecture, wonderful presentation. Thank you.
Thank you, ma'am. Thank
Yeah.
you, ORDI, for this opportunity.
Thank you so much, ma'am.
Thank you.
Thank you.
Yes, yes. Thank you.